Our next speaker is Susanna. She's this is also our first time giving a nutrition lecture. We're excited to have Susanna join us. I occasionally give community talks out to different hospitals and different clinics, and I'm always impressed with how many questions come about nutrition and pancreas cancer. And I realized that this was a really important lecture that we had not put on before. So we're excited to have Susanna. Susanna has been with us for a while. She originally was with us on the transplant team. She was with us and she had a baby and she's on a different service. But Susanna's been very dedicated to us. She's actually one of the first members of our Nancy Lyle Ambassador Program. I hope everybody gets a chance to learn more about that through the day. But welcome, Susanna. I'm looking forward to hear what you have to say.
Thank you so much for having me. This is an honor to be here. I'm really grateful for this team and just to have this opportunity. So I'm going to set a timer for myself or else I will talk a little bit over the 25 minutes I have. So let me go ahead and start that. Okay, so we're going to look at optimizing nutrition in pancreas cancer patients. I have nothing to disclose. Click through all these slides. So our objectives for today: to understand the role of the pancreas and its role in digestion, learn the role of nutrition in preparing for pancreas surgery, understand how nutrition is impacted by the pancreas, and to demonstrate how nutrition is affected post-surgery and how to optimize nutrition. So we're going to delve right in. So why is nutrition important for patients with pancreatic cancer? A lot of times patients come in and they already have a compromised nutrition status. So they may have unexplained weight loss, they may have altered absorption, altered blood sugars. And so right off the bat, they are already set back nutritionally. Then leading into treatments, a lot of times they have a compromised nutrition status going into treatment as well. Treatment can exacerbate a lot of the symptoms that they're already having. For example, like exocrine pancreatic insufficiency, which we're going to delve more into later. They also can have taste changes and other side effects. And then prior to and after surgery, adequate nutrition can really help with maintaining your muscle mass, recovering faster after surgery, improved immune function, and then improved GI function after the surgery as well. More than 80% of patients with pancreatic cancer develop malnutrition. That's a big number. So whether this is prior to surgery, prior to treatment, after surgery, it's obviously very common to develop malnutrition. So my role and goal as a dietitian is to try to minimize that as much as possible, because malnutrition can lead to skeletal muscle loss, fat degradation, longer hospital stays, reduced quality of life, increased risk of complications, and then reduced response to treatment overall. So it's been shown that there are better treatment and surgical outcomes with maintenance of muscle mass. So we do this with adequate nutrition and exercise. Weight loss of greater than 5% has been associated with higher surgical infection rates and longer hospital stay. So one of the key things is to have a dietitian on your team to screen these patients that are presumed to be at risk. The dietitians will assess the patient by asking about unintentional weight loss, the time frame of the weight loss, appetite, and how the patient's been eating, and they'll assess the muscle and fat stores of that patient. So let's look at the role of the pancreas. So what does the pancreas do? I like this illustration because it's a little bit different and kind of quirky. The pancreas is very important in digestion, obviously. As a dietitian, I'm looking at the two functions of producing digestive enzymes and also making hormones such as insulin. So the pancreas produces these enzymes, lipase, protease, and amylase. And if we have any patients here who are on any replacement therapies, lipase is probably one that stands out. The pancreas makes hormones like insulin, which regulate blood sugar levels and appetite. So obviously here is a picture of the pancreas and how it's connected to the small intestine. So as the enzymes travel through the pancreatic duct, they join with the common bile duct and dump into the duodenum, which is the first part of the small intestine. So when you're eating, Your food goes into your stomach, acid breaks it down, and then it goes into the small intestine. And this is where bile from the liver and the gallbladder and enzymes from the pancreas help to digest and absorb the foods. So the enzymes aid in digestion by breaking down these fats, proteins, and carbs. And if there are not enough enzymes, then symptoms do occur. So often the pancreas is not able to make or secrete enough of these enzymes necessary for digestion, and this is called exocrine pancreatic insufficiency. It's very common in pancreatic cancer as well as any disease of the pancreas, such as pancreatitis as well. It can be related to the cancer itself, or it can be related to treatment. It can be caused by the treatment. And it occurs in up to 94% of pancreatic surgery patients and to different degrees. Symptoms can include unintentional weight loss, indigestion, pale or oily bowel movements, diarrhea, excessive gas and bloating, and then a lot of times abdominal cramping, especially after eating. Some patients end up needing these pancreatic enzymes for life. Others may just need them for a few months after surgery. Patients who have radiation therapy in addition to the Whipple procedure are more likely to have long-term malabsorption due to the impact of the radiation on the pancreas. And there are a lot of over-the-counter digestive enzymes, but it is not recommended to take these as they are not regulated by the FDA. And so we don't exactly know what is in them. And a lot of times they don't have enough lipase to help you actually absorb and digest those foods. So let's look at the three individual enzymes. So lipase works with the bile from the liver to break down your fat molecules, and so they can be absorbed and used by the body. Sorry. Without the lipase, the body has trouble absorbing fat and fat-soluble vitamins, so your A, your D, E, and K. Deficiency can lead to the oil that you see or fat malabsorption in your bowel movements. Protease breaks down proteins and keeps the intestines free of parasites such as bacteria, yeast, and protozoa. Protease shortage can cause allergies due to the incomplete digestion of the proteins. And then, of course, the amylase breaks down your carbohydrates into sugar. So over on the right here, this is the amount of lipase that your normal pancreas makes. So on average, about 720,000 units of lipase. Now, when we look at pancreatic enzymes, you're going to see that the dosage is a lot less than what your pancreas is making. And one thing I've noticed is that a lot of patients are underdosed when it comes to the pancreatic enzymes. And so it's really important to make sure that you're giving an adequate amount so that way you're optimizing the nutrition and absorption for these patients. So the recommended starting or minimum dose is 500 units of lipase per kilogram of body weight. So if you have an 86 kilogram male, he would need about 43,000 units of lipase per meal. Most enzyme capsules are between 20,000 and 40,000 units of lipase per capsule. I usually recommend using more of the like closer to 40,000, so that way you're not making these patients take a ton of pills. Because a lot of times they're on other medications as well. So for this patient, he would need about 2 capsules per meal because we don't want to decrease the amount. We'd rather round up. So about 2 capsules per meal, 1 capsule per snack for this patient. Enzymes should be adjusted based on the symptoms that the patient's having, based on the quantity of food, and then a lot of times it needs to be based on the amount of fat in the diet. I had a patient who was about 98 pounds, and she had to take, I think, 4 enzymes per meal, sometimes 5, and then 2 to 3 with each snack. So she was taking a lot, and we just kind of got to that point through trial and error. So we basically started with the lower dose, increased as she needed it. And then ultimately, this is what helped with this, large numbers, what helped with her absorption. So I'll usually tell people once they start on pancreatic enzymes, try it for a few days and you're going to notice a difference. And usually right off the bat with that first meal they do. Appropriate dosing improves symptoms, improves quality of life, and improves outcomes. And usually these are used in conjunction with acid-reducing medications as well. Another question that I get, what diet should I follow? And so it is not a one size fits all. It is definitely individualized. So that's why it's important to really know a history of a patient, to know their nutrition background, so that that way, we can appropriately help these patients. It's not a diet, it's an eating pattern. So based off of symptoms, if you're having early fullness, then we're going to recommend doing smaller, more frequent meals. And especially, in these patients who may not be able to eat a lot at one time, you're not going to be able to meet your protein and calorie needs by just having one meal a day. And so that's why we recommend spreading it out. We also recommend a balanced diet of your fats, your proteins, and your carbohydrates, and trying to pick healthy options of these. I don't ever recommend eliminating one macronutrient, because you're already focusing so much on treatments and stuff. And the last thing we want to do is really take away a large portion of your food options. The Mediterranean diet is a great diet option, because even though I hate the word like diet at the end of that, but it focuses on fiber and healthy fats. And so that way you're getting this good nourishment for your body. So let's look at the proteins. So we want you to focus on quality proteins. We want our patients to focus on quality proteins. So animal proteins are going to be a higher quality protein than plant proteins. So you don't have to eat as much to get as many grams of protein per serving. That's not to say that you can't meet your protein needs on a vegan diet, but it's appropriate to pick the right options. We recommend including a protein source with each meal. Again, like I said before, you're not going to be able to meet your protein needs if you're eating 1 to 2 meals a day. The protein needs are very individualized. So usually a range is about 1 to 1.5 grams per kilogram body weight. So if you have someone who's 160 pounds, 70 kilograms, they would need about, or 73 kilograms, they need about 73 to 109 grams of protein per day. And what's going to help you to maintain your muscle mass is protein plus exercise, and then also calories in general. And if you are exercising, if you have a protein source after you exercise, that's going to help you to maintain your lean body mass even better. So let's look at carbohydrates. One question I get all the time is, does sugar feed cancer? How many of y'all have heard this question before? Yes. Oh wait, I didn't go to that slide. So there is no evidence that sugar feeds cancer cells over other cells in the body. Sugar alone does not feed cancer. It's more than this. All cells use glucose, and cancer cells are normal body cells that are growing abnormally. So they also use glucose. If you cut out carbohydrates, your body will just convert proteins and fats into glucose, which can lead to the breakdown of your muscle mass to be used for energy. So again, sugar as a whole is not what feeds cancer. If you're eating a diet that consists of a lot of processed high sugar foods, then you may not be getting healthy foods that do provide those antioxidants and other beneficial nutrients to your body that help to fight the cancer. So it's there's a lot of different caveats to it. We do recommend avoiding eating carbohydrates by themselves. And it's recommended to have a protein source or fat source with them to help keep the blood sugars from spiking. The faster a carbohydrate food is digested, the more the blood sugars will rise. Now, this is based on if you're able to tolerate it. If you're having a lot of side effects from having more fiber in your diet, say you have elevated blood sugars and you're not really wanting to eat very much, you're like, I can't really modify my diet because there's only certain foods I really want to eat, then in that case, it might be better to use medication or insulin to help control the blood sugars. So we don't want to completely put you on a crazy intense diet, adjusting your carbohydrates if you don't even want to eat at all. So there's other ways to work around this. But if you can tolerate, then having more soluble and insoluble fiber will help to control your blood sugars a lot more. So really including these in your diet if you can. So let's look at fats. So a lot of patients come to me and they say, well, I have pancreatitis or I have pancreas cancer. I've been told that I need to cut out fat. And again, like I said before, we don't want you to completely cut out any of your macronutrients. So the goal is to use the pancreatic enzymes to help to digest and absorb your fats to avoid having to go on a low-fat diet. because fats are a great calorie source. There's 9 calories per gram of fat, and whereas there's 4 calories per gram of protein, 4 calories per gram of carbs. So fats are a great calorie source. I do recommend avoiding processed fats and focusing on healthy fats. So as you can see over here, foods like olive oil, olives, nuts, chia seeds, flax seeds, these are all going to have your monounsaturated fats. And so these are going to be the best option when it comes to tolerance and absorption. Medium chain triglycerides are absorbed better than long chain, short chain. And so this is really useful in those who are having any fat malabsorption because it's rapidly absorbed by the body and bypasses normal absorption for fat. So let's look at nutrition-related side effects and how we can manage these. So I looked at some common symptoms that our patients experience. So this is not, everything, but it's things that our patients have really complained about. And so we're trying to, again, mitigate those symptoms and help to improve their nutrition. So poor appetite is something that a lot of my patients experience, whether it's pre-surgery, pre-treatment, or after surgery, after treatment. So like I've said before, eating small, frequent meals throughout the day really helps to not necessarily increase your appetite, but to really meet your nutrition needs. Schedule meals and snacks. So trying to maybe set an alarm on your phone and to tell yourself when to eat. This has worked for a lot of my patients. I know it sounds kind of strange to do because, a lot of people are like, well, who would forget to eat? But it is very common in a lot of our patients. So I'll tell them to set an alarm on their phone, and that's worked well for them. Use liquid calories. So if you're one who doesn't like to sit down and eat a full meal, make a smoothie or something that's high calorie, high protein. And that way you can do work around your house and just drink a smoothie while you're doing that. And then also liquid calories are going to be absorbed faster than solid calories. Nutritional shakes and supplements. There's a lot of them out there. And so these are great options as well. Light activity, so walking prior to eating can help to stimulate your appetite as well. And then a lot of our patients do end up needing an appetite stimulant. A lot of times we see this more after surgery, but still that's something that's very common too. Early satiety or early fullness is definitely something that we see a lot. So our goal is to try to instruct our patients to avoid foods that would contribute to gas and bloating. Things like cruciferous vegetables, high fat foods, high fiber foods. These are going to make you fuller faster and for longer. So trying to cut back on these. Consume liquids between your meals. So if you go and drink a whole cup of water and then go and try to eat something when you're having these symptoms of fullness, then you're probably not going to want to eat much. And then you've just consumed a whole bunch of water, which doesn't have any calories. So trying to drink those fluids between your meals. And then small servings more often. And then we also want to assess for that exocrine pancreatic insufficiency. Is there a reason why you're having this fullness? And if that's the case, then putting you on the appropriate enzymes. And then ultimately, if patients have delayed gastric emptying that is causing the fullness, then we definitely want them to try some medications to improve motility. Nausea is also something that a lot of our patients experience, again, at any stage of the treatment or surgery. So one thing that our patients have noticed is that when they smell something, a lot of times if it's like something hot that's cooking in the kitchen, they say that the nausea is overwhelming because of just the smells. So trying to eliminate any smells that could really trigger that nausea. If you make more cold foods, then they're not going to have as much of a smell. So that can really help with eliminating or helping with the nausea. And then, of course, smaller, more frequent meals. If you don't eat a whole bunch at one time, if you're just eating a little bit all throughout the day, then that's going to help to prevent you from feeling nauseous as well. And then eating more bland foods. Notice I included dry crackers and toast, but with peanut butter on it too, so that way you're getting a balanced meal there of your proteins, your fats, and your carbs. And then avoid greasy, fried, spicy foods. And then also oral care is really important. So making sure that before you eat, your mouth is cleansed, maybe using some of the over-the-counter like Biotine mouthwash, stuff like that. Or like baking soda and water and swishing your mouth to help to kind of cleanse your palate. And then eliminating stress, because if your body's in fight or flight mode all the time, then you're going to feel more nauseous. I know that's easier said than done, but just trying to eliminate stress in your life. And then if you're dehydrated, that can also contribute to nausea. So trying to make sure that you're getting enough fluids in throughout the day. And then ginger chews. Ginger has helped a lot of people, as well as those C-bands they sell at the stores. I know that that's something that we've considered for patients too. And then ultimately, a lot of our patients do end up needing a anti-nausea medicine. Taste changes are also very common, especially after undergoing chemo or different types of chemo. And so again, like I said before, trying to make sure that you don't have a bad taste in your mouth prior to eating will really help to make the foods taste better. A lot of our patients complain of a metallic taste. It's very common. So instead of using regular silverware, use plastic utensils. Also avoiding canned foods. A lot of times after going through treatment, you may notice that you're way more susceptible to this metallic taste. So you may actually taste the tin of the can. Enhanced dull taste. So trying to use like lemon juice or vinegar or extra seasonings to try to really enhance the flavor of the foods. And then trying new foods daily can really help too. Your taste can change every day. And so keeping a lot of variety around the house can help. And then especially after surgery, or if you're malnourished, you're more likely to have a zinc deficiency. And so this is something we would assess for as well. And if necessary, we would supplement. Usually it's a high dose for about a month. Diarrhea is also very common. The first thing we want to look at is what is causing the diarrhea. So if it's exocrine pancreatic insufficiency, we want to make sure that you're getting the appropriate dosage of the enzymes. Maybe it's related to dumping syndrome where you're eating a lot of sugar. So we want to try to cut back on that. It could be lactose intolerance related, or it could be treatment induced. A lot of medications do have a side effect of diarrhea. So trying to figure out what is causing it, and then also limiting or avoiding certain types of fiber, as well as sugar alcohols, which can have a laxative effect too. So some overall nutrition tips. So I know I've said it over and over again, but trying to eat small, frequent meals. So if you eat every 1 to 3 hours, even just a few bites an hour, it adds up throughout the day. Separate foods and beverages. So again, trying to have liquids in between your meals as opposed to drinking a whole bunch, right before you're eating. Keep a food journal. So this can help to help our patients to assess the tolerance of foods and to identify intolerances. So if there's something that didn't sit well with you, then maybe you can look back and say, okay, this is what these food groups have in common. I'm going to, maybe cut back on these things. And it also helps to keep track of calories consumed, because it may be that you don't feel like you're eating a lot in one day, but you look back at your food journal and actually you did better than you think, and it can kind of be reassuring. And then eat when you feel hungry. So even if it doesn't feel like mealtime, if you want to wake up in the middle of the night and have a little snack and you feel like eating, go for it. And then having snacks around the house that are high calorie, high protein, and things like trail mix, nuts, things that you can just walk by and grab a little bit, and then that way you're getting that extra nutrition in. So in summary, the symptoms that affect nutrition should be addressed as soon as possible. Pancreatic enzyme replacement therapy with appropriate dosing should be used at the onset of symptoms. The avoidance of malnutrition will help to improve patient outcomes, and then balance macronutrients. So your proteins, your fats, and your carbs for an overall healthy diet. And then speak with your provider and or registered dietitian about how to manage these nutrition side effects.
Thank you, Susanna. You can see why the National Pancreas Foundation, when they recommend centers of excellence or approve the center of excellence, you have to have a dedicated nutrition on your service. And we're fortunate to have worked with Susanna. We now have 2 on our service as well, with Lindsay and Molly. So thank you all for what you do with nutrition. I'm curious. I don't know how many other clinicians are in the room, but I trained at one place where if you said Creon, you got laughed out of the room. And I went at another place and you said Creon, and they had it down to a science, like down to the microgram, it seemed like. But I'm curious, any other people or comments from the audience about what you're being told about Creon? And I'll just put Dr. Sachs on the spot and see how they do it in Boston.
Yeah, we certainly are on the pro Creon team. It works, for most patients, as I'm sure Susanna knows. It doesn't work for everyone, and there are some alternatives out there to Creon as well, which are still options. But it's one of the ways that we can get our patients back to their nutritional self. Yeah.
Yes, ma'am. Question was, where is this information available to the public?
So PanCan does have a lot of information about nutrition on their website. And then also speaking with a dietitian through, Dr. Page or through any of the pancreas cancer surgeons as well. But PanCan is a good resource for a lot of our patients too. They have like a brochure and stuff on there as well.
Yes, ma'am. Long way to go. We're going to have more microphones up for the second session.
Thank you. So one thing that I've read a lot about is like the idea of like sugar being an inflammatory, consuming sugar could cause like inflammation in your cells and things like that. And the idea of like maybe like by reducing the amount of sugar that you're consuming, especially like when you're going through something like chemo or things like that, it could actually help your body like reduce like stress in other areas to be able to focus on like absorbing the treatment. Is that something that you like agree with or like know about? Or
Yeah, so when it comes to sugar, it's important to avoid added sugars. So those are the sugars that are going to get into your bloodstream quickly, cause a spike in your blood sugars, which is what can cause that inflammatory response. So that's why I always recommend focusing on incorporating more fiber into your diet so that way it slows that absorption and digestion of those sugars and helps to reduce the spikes in the blood sugar, which helps to in turn reduce that inflammatory response. So yes, you're right.
Last one. I'm getting too many steps in today. I'm just kidding.
Hey, Susanna, how's the threshold for supportive nutrition like TPN and tube feeding incorporated into this overall diet plan?
So a lot of our patients do end up needing extra nutrition support. The goal overall is to try to use the gut when you can. So if they aren't eating enough or if there's an issue with delayed gastric emptying, then using enteral nutrition support via feeding tube to try to help to stimulate the GI tract. Now, if there's an obstruction lower down and you're not able to, and enteral nutrition is not an option, then maybe short-term TPN or total parenteral nutrition would be a good recommendation to try to get you over that hump of this malnutrition and to get you back to eating. So those are good supportive measures, but ultimately our goal is to utilize the GI tract as much as possible.
Great. Well, thanks everyone. We'll take a quick break. I'm hearing a lot about this